You're listening to the We Are Libertarians podcast network. Find all of our shows at wearelibertarians.com. Welcome to the Chris Spangle Show. Thanks so much for joining us here on the program. And today we've got Dr. Eric Larson, who is joining me to talk about Robert Kennedy Jr.'s priorities for making America healthy again. So we'll talk about that right on the other side of this break. So we are talking today about Robert Kennedy Jr., and Dr. Eric Larson is a podcast host of a show here on the We Are Libertarians podcast network called Paradocs. I like to think that it's just currently in mothballs and will eventually be resurrected. It does get a lot of listens. I told you, I was surprised at the amount of people that still listen to the show. It's like 700 downloads a month.
Me too. I don't think I've had a new one for probably a year. Yeah, it's definitely in hibernation right now. It's just too busy. I have another podcast that I do, which is based in Michigan State basketball. And so that we're doing 12 to 15 shows a month during the season. And that's, I'm doing the editing, I'm doing the posting. And so and I'm working full time, with a real job too. So
yeah, tell me about it. It's a lot, but hundreds of listeners a month to the show. And you were a trusted voice, somebody that I listened to and really leaned on understanding how COVID was working, how all of these things were going on. Somebody I could text and be like, give me a medical opinion. And we're here to say that this is a policy discussion. This is not a medical discussion. I'm certainly not qualified. I don't look, I'm Robert Kennedy curious. I don't know if he's a crazy person. I don't know if he's a truth teller. I don't know a ton about him. So we'd be interested in your comments if you're watching live, or feel free to send me an email, chris@chrisspangle.com, with things that you'd like to add to the discussion, and we can add those in on a later show. But I think the Trump administration is going to be really interesting, because you're going to have people leading these agencies who are deeply skeptical of their agencies. And maybe in the Reagan administration, that was kind of the case, but not like this. Like when you've got Matt Gaetz at AG and Tulsi Gabbard at DNI and like the FCC guy, the FCC guy is a big mistake. But Robert Kennedy Jr., I think, is one of the most interesting picks on what's going to happen, because he is my depth of knowledge about Robert Kennedy Jr. is the Rogan interview. And he seems to have at command, like this Rolodex of facts and studies. And, it comes off, if I don't have your knowledge with a medical degree, I go, wow, okay. I'm trying to see where this guy's wrong. Because you look around and you go, man, there is something like with the food. Like I saw a TikTok the other day of, hey, if you live in another country and you come to America and you go visit home, do you lose 10 pounds immediately? And everybody was like, yeah, when I go back to Guatemala, I lose 10 pounds of water weight. So I think the average person listens to Robert Kennedy Jr. and at least is intrigued as to what he's saying. We're not going to particularly go into everything. We're going to talk about what we think Kennedy's going to do, what his priorities will be, some things that he ought to do from a libertarian point of view, especially, and what we think he can actually get done. But why don't you introduce yourself first, kind of tell us a little bit more about your background, other than you're a podcaster, and give us some of your medical credentials, and mention your podcast name again, because you kind of went fast with that podcast name, but please plug it again.
Yeah, it is. Well, so the podcast that's on your network is the Paradocs, and that's Paradocs, where I interview another physician. And so it was always I tell lots of bad dad jokes. I'm an anesthesiologist, so I tell all the puns in the OR. So the Paradox was what I thought was a clever idea. And of course, as soon as I mentioned that to other people, they're like, oh yeah, that's the name of my boat or something like that. So it turned out not to be that unique.
You're a Michigan State fan, which we're not going to hold against you, but did we beat you yet?
Yeah, in football. Yeah. But pretty much everybody's beat Michigan State. That's, kind of like beating a rug. It's pretty easy. Okay. My son actually is at Purdue now, so he is not an Indiana fan. I know you were an Indiana guy, so
yeah,
we'll just let that slide for now. Yeah. Well, he's got.
But what's your sports
season.
podcast?
It's called The Final Four Is Not on the Schedule, and so it's a Michigan State based basketball. So if you're a Michigan State basketball fan, number one Michigan State basketball podcast in America. it's usually top 100 of all basketball podcasts. So it's actually very successful. It's fun doing that. A bit of real joy. I go to the games anyway, so it's great for me. And actually, if you go back to the Paradocs, a lot of those, I would say most of the shows are evergreen. There's certainly the COVID ones are less topical now than they were at the time. You can sort of see our evolution as we're trying to figure it out. But I think for the most part, got most things right with most of the people I talked to. I had Jay Bhattacharya on twice. And so he is going to be tapped, it looks like, as the new director of, I think, NIH. And so it'd be very interesing. That's a great spot for him.
Is that what Fauci leads, the NIH?
No, Fauci was head of the NIAID, which was maybe he was NIH too. I can't remember. It's kind of weird. He got appointed that weird COVID czar's position,
right?
But I know he's in charge of the what's the National Institute for something immune diseases. I can't remember. Yeah, infectious diseases. I think. Anyway,
Bhattacharya seemed to have a lot of the pandemic right from early in the pandemic, and so it seems to me that he would be a good pick for somebody to lead the National Institute for Health. What do you think?
Yes, I think absolutely. I think, the thing about Bhattacharya that I like a lot is, for one thing, he's the kindest guy. Like, he was really genuinely, like, really nice man, which was great. But he has a level of frankness and honesty. He's an acceptance. He's a real scientist. Like, he accepts where the facts lead you is where he's okay. But he also feels very strongly about discourse within the science world. I mean, it's crazy that we had science that had no discourse, that there was no disagreement, that things were outside the bounds of discussion. We always use the term equipoise in medicine. And so that just means if there's a question and it's not exactly obvious what the answer might be, then you have to study it. So gravity is not equipoise. So someone says, well, vaccines are great or whatever. There are probably some discussions to be had about vaccines, but to say, well, saying vaccines are not good is like saying a parachute doesn't help me jump in an airplane. That's not the same, because obviously you don't need to do any studies to know that you need a parachute to jump out of an airplane from 10,000 feet, right? I mean, that's clearly the case. So equipoise is when there's some sort of discussion and there's some question about things. And that was COVID, right? That was like, what do we do? Do we mask you? Do we, have vaccines? Do we stay 6 feet apart? Do we, do these medicines work? All those things needed to have discussion, and there just wasn't any. It's short circuited through, various means I'm sure you've talked about in your show as well. So he's just very much in favor of a market, a place of ideas and discussion and actual scientific inquiry, which I think is real important. I mean, that's, to try and bring the academy back to where it belongs. That's what we need. And the NIH, you certainly can push directions and get answers that you want, or just study certain things, not others. And so I think he'll have a more even hand in that, but, we'll see how that goes.
Yeah, so he's picked Robert Kennedy as the Secretary of Health and Human Services, and the primary responsibilities for that are overseeing the agencies like the CDC, the National Institutes of Health, the Food and Drug Administration, managing policies and programs for disease prevention, research and public health emergencies, healthcare programs. He would be overseeing the administration of Medicare and Medicaid and the Affordable Care Act. The human services part of it comes in with the temporary assistance for needy families and Head Start. There's also the regulation of food and drugs through the FDA, Substance Abuse and Mental Health Services Administration, Office of Assistant Secretary for Preparedness and Response, and Global Health and Diplomacy. So there's quite a bit in that portfolio that he would be managing and having a lot of people report. These jobs typically are... I look at a lot of people being very excited that he gets to get in there and make a lot of change, because I think people I don't want to say ignorant, but like, people have regular lives. They don't like spend all their time thinking about how a government bureaucracy works. You don't have like dictatorial power. So you've got to pick and choose, I think, where you want to start, and especially when you only have 4 years and you have a lame duck president. Let's start with what you think Robert Kennedy Jr. is going to do. Like, what do we know about his priorities and where he wants to set policy and directions for these agencies? What's your gut say?
Let me first begin as a representative from Generation X, Gen X, you're welcome, and F you to the country for the election of Donald Trump, since it looks like we were the ones who brought him in.
You selected him. The only generation that went, surprisingly, boomers didn't go to Trump. It was Gen X was the only generation.
Yeah. Well, our generation is defined, I think, by the two movies I always think of as Reality Bites and PCU. And I think those, if you are familiar with those films, they really encapsulate what it means to be Gen X. And you can look those up. And so it's not, what happened is not surprising to me. And unlike the first term, I think this feels very, very different. The transition feels much different than it was the first time he came into power. Whereas now he's getting people who are not just kind of cronies or whatever. They're people who I think are looking to actually, I mean, I don't want to say drain the swamp, but certainly affect real change. And I feel like that was not the case outside of maybe Betsy DeVos, the Secretary of Education, the first term, that she had a clear agenda and things she wanted to do with school choice and charters. And so RFK Jr. is
like Rex Tillerson at Secretary of State. You couldn't have picked a better swamp creature than that guy, right? Right.
Oh, I mean, Pompeo. I mean, there are all kinds of, it's littered with people who've been there time. I mean, we'll begin first by saying there's every reason to believe, if you look at Trump's first term, that RFK will not survive 4 years. Mm-hmm. So we'll just assume he makes it through. But RFK is absolutely 100% a reflection of what happened in 2020 through the COVID and the lockdowns and COVID. The reason he was popular is, especially those on the right, is because of his resistance with the COVID policies, skepticism of the COVID vaccine, skepticism towards the mandates, towards all the stuff that kind of went with COVID. And I think in many ways he was right about a lot of that stuff. But, the question is, was he right because he is first principles that he's right, or is he right just because he happened to be right and he had a big platform? So that'll be the real question. What does he want to do? I mean, he clearly has, if you made him like Secretary of Energy, I don't know that he'd have any clear policy, right? I think, but he definitely has
energy, maybe, but environmentally he'd be a disaster. And
right. Yes.
If you don't know Robert Kennedy's background, let's just refresh people. He's the son of Robert Kennedy, who was assassinated in 1968, brother of John Kennedy. He is as elite as they come. He went to Harvard. He's a lawyer and has spent much of his career working in environment. I remember being a good little bushy back in 2004, hating Robert Kennedy Jr. because he was anti-war and a Democrat and, Greenpeace all the way, right? He was a big environmental lawyer who would come in and sue Monsanto for certain things, or mercury levels in water, and suing coal companies for releasing those things in. And then along the way, he started focusing on children's health and vaccines. And he's not a public health expert. He's a lawyer specifically trained in environmental law who just happens to have a big platform. And he may set himself up as an expert, but he says explicitly, I'm not a public health expert. Yeah. And so that's sort of the background. He ran for president as an independent this year, and it started as a Democrat, realized that it's impossible to work through the two-party system, became an independent. That didn't work, dropped out, endorsed Donald Trump, and now he's looking at this. So that's just a little bit about his background. But yeah, he seems very focused now, less on the environmental side and more on the public health side. He wrote a book called The Real Anthony Fauci, which focuses on a lot of what Fauci did with AIDS and how detrimental it was towards the gay community and solving the problem of AIDS. And now, and also talks a lot about vaccines. He's vax skeptical. I wouldn't qualify him as anti-vax. You tell me if you disagree. He's not against vaccination, but he has problems with the way that they're formulated and what goes into the vaccines and the toxicity of it.
Yeah, I guess I was talking to my wife about this last night. On a scale of anti-vaccineness, 0 being someone who thinks every vaccine should be given to everybody all the time, and a 10 would be someone who is like Andrew Wakefield, who believes that every vaccine causes autism and causes real problems. I'd say he's somewhere like 8-ish, maybe 7 to 8. So he's fairly skeptical about most vaccines, I think. But again, that's not the nuance that we need for most of the discussion, which is unfortunate because, of course, most of these discussions are not nuanced. They need to be. But he's a guy who wants to do. He has a lot of ideas, And I think some of them are pretty good. But so he stated explicitly that, and also to back up, 2008, he almost got tapped by Obama to take over this position too. And they didn't think they'd make it through the confirmation process. So it's very interesting, right? This is not that surprising. He's back here again. He wanted to focus on chronic diseases. So he said he wants to focus like diabetes, obesity, autoimmune diseases, addiction, suicide, over infectious diseases. He thinks there's been too much focus on viruses and bacteria, those things with medications. So I think to try and get away a little bit from pharmaceuticals is, I think, his general gist. He wants to make food healthier, whatever that means, whether it's making sure it's more nutritious, there's less additives or preservatives, those sorts of things. He wants to remove liability from immunity for manufacturers of vaccinations. I mean, you see that most medicines, there's not a level of immunity for pharmaceutical companies, but there is with vaccines. So if you develop a vaccine, you can't be sued in a class action lawsuit, for instance. So I think Pfizer was taken, I think it was Vioxx. They got hammered. That was like one of the biggest, I think they lost over $1 billion. I think with Vioxx turned out to cause cardiovascular disease. And so they wouldn't be susceptible to that sort of thing. And so that was a law put in place, I think, in the 90s by Congress, because they're worried about there wouldn't be manufacturers to make vaccines because there's not a lot of money to be made. We've clearly seen that change with COVID.
He argues that this was put in because vaccines are inherently dangerous.
Right.
Which, I mean, I think when you look at like COVID, I think explains a lot of this, right? Just to kind of pause where we're at on this train. Mm-hmm. Like, health is so personal for people, especially the older you get, right? Like, I never thought about my health till I was in my late 30s, right?
So you don't have it, right?
Right. Yeah. And then you're like, oh, it hurts when I work out. Why does it hurt there? Yeah. And then you go through COVID. And I think COVID is one of those periods where we enjoy the air we breathe. We don't understand the stability that comes with being an American, the inherent security of it. And there's this notion that there are experts in every field that are, the National Weather Service keeps us safe from hurricanes by letting us know what's going on. And we just sort of trust that those meteorologists know what they're doing. Our meteorologists on TV are idiots, but those meteorologists know what they're doing at the National Weather Service. And if there's a vaccine and your doctor tells you to take it, then it just must be trustworthy. And then the pandemic hit, and we spent 2 years hyper-focused on our health and fighting with each other, which makes you go and do your research to make sure you're right. I think there's a lot of implications for COVID and what it's done to the public discourse, to how people vote. But I think in this particular area, vaccine skepticism, like, that used to be like a cranky thing. Like, you wouldn't ever mention that you were that way. And now I would bet 30 to 40% of the country kind of thinks he's right on it. And then that's probably going to be 50 by the end of this term, So
yeah,
I think there's, and that attitude of, you can't talk about this. We're going to ban your YouTube show. We're going to take you off. It just, I really wish Robert Kennedy could sit down with, I don't know, a Fauci-like figure and just have a conversation and a debate back and forth in like a healthy manner. But it's one of those facts, like, having immunity for drug makers for vaccines seems really suspicious, Dr. Larson.
It seems fishy, for sure. Yeah. Yeah. And the problem with, in defense of the measure with the current law is, you'd say, well, it's really, many of the things that you're getting sued about are very difficult to prove. Like, you have to use population-wide studies. Like obstetricians might be, if there's a delivery that doesn't go real well, the baby looks a little blue for a little bit. After a few minutes, perks up, looks fine. Is that kid not getting into Yale 18 years from now because they were a little hypoxic or is that sort of typical? There are things that are hard to believe, and from a liability standpoint, they're hard to prove, or at least expensive to disprove, or, to fight. And so that was the concern. I mean, however you think about that, I think that's a lot of the concern, because it's just hard to, just like what's the safe level of a pesticide? Is it 20 parts per million? Is it 40 parts per million? At what point does it cause brain damage or cut cancer risks? Well, Is it rare cancer, slightly less rare in this one town? Is that because of pesticides? These are hard things to ferret out and sort of figure out. And so I think that from a litigious society, the concern is trying to get away from that. So, I mean, that is both, so you can feel about that however you want, but I think that's the thinking behind preventing those things as well.
Yeah. I mean, just from a first principles standpoint, I mean, if we had a free society, like you would want to have private lawsuits against companies that provide a product and just giving them blanket immunity. I don't know. I can see the argument that, look, you'd sue you'd sue them into oblivion. But also I don't know. I don't know how I don't think I like the idea.
We can talk about it later too. I mean, this is just what he wants to do.
Yeah. Right. So I mean, there's only so much you can do. So focus more on chronic diseases as opposed to infectious diseases.
Yep.
Work on making food healthier.
Yep. Removing indemnity from the vaccine.
Yep.
When it comes to regulators and advisory boards, advisors and advisory boards, the ones who make decisions of like the stepwise pattern of pharmaceuticals or interventions in medicine, to disallow those people from going into the private sector. So, for instance, the CDC director almost always retires and goes and serves on a pharmaceutical board, and these or FDA, I should say. So is that making sense? Is that right for someone who, works as a regulator and then immediately goes and works for Pfizer or, AstraZeneca or something like that? And so he wants to disallow that. And that's that revolving door. That's we're getting approval for this medication, even though it might not be that safe, because I know, wink, wink, I'm going to get a job that's going to be paid 7 figures, 2 years from now. Right. That's a concern. I mean, that's throughout all portions of government, but he's just focusing obviously on the pharmaceutical part aspect of it. To study vaccines more thoroughly, to make sure they're better randomized trials, to make sure they're safe. Also looking at pesticides, and that maybe goes along with the food safety, but just pesticides and environmental toxins, and making sure that we're testing them properly and, that they're getting the chemicals out of the foods. I think those are sort of the main 6 sort of, things that he's looking to do. Certainly other things too, that I think he also mentioned that he's interested in deregulating some drugs like marijuana and psilocybin. I can never say that properly, but so I think those are other things that he's mentioned in the past that he was interested in doing.
I would add a 7th, just from a political standpoint. I think one of the things that Trump is going to do is a lot of investigations. This is going to be the presidency.
Oh, you mean like into Fauci, et cetera?
Oh, yeah. If Fauci needs a lawyer, I think every I mean, yes. But I think what he will do is Robert Kennedy will have access to all the documents he ever wanted. He can. Yes. Here's a guy who likes information, who's asking and suing, Fauci's office for certain documents and not getting them. Well, now he can walk in and get access to whatever information he wants.
Absolutely.
And I think that will happen across the board. And, it's for my friends, everything, for my enemies, the law. So I think that may be, if you focus on retribution, you don't get a lot of the things done that you want to get done. So we'll see where the Trump administration at large and Robert Kennedy fall on that spectrum. But I would add the 7th is just documentation, document gathering.
Yeah.
And I think investigating Fauci in particular.
Yeah, no, I think you're absolutely right. I think he and his cabal of people who were in the, who are the NIH and the CDC, FDA at that time, they're all going to be examined. I mean, the smart thing for Kennedy to do, I think, is, and I think you're absolutely right, that's probably one of the goals of his is you just make it all open and just kind of let other people take it over and don't actually pursue it yourself. Just like that thing's going to work itself out, whether it's Congress picks up the ball or private journalists, citizen journalists, which there are plenty of, who will pour through those documents. That's going to get you all the answers you want. And it'll put the pressure on where it belongs, I think, especially if you've got all the documentation. So yeah, you're probably right. That's absolutely something that he's going to do, but you could do that in day one and just be done with it. And then work on the other stuff. I love
your idea. And I think that's exactly what they should do in all these different areas. Just make it as transparent as possible.
For sure. Open those emails.
Yeah. So those are like the broad things that he wants to do. Those are his general focuses that kind of are what attract people to him.
Mm-hmm.
Maybe we should talk about things that we think will actually happen and then go to the things we think RFK ought to do.
Right.
If that makes sense.
Yeah, no, I think so. I think so. I do think the indemnification will be removed from, and
Really?
I'll admit I'm not. Yeah, I think that'll be removed from vaccine manufacturers, which I'm not sure that it's the wrong thing. Like you said, it does seem suspicious. It's probably going to force more robust testing. And I think with the COVID vaccine, we clearly saw a dereliction of duties by the FDA in the testing process. I mean, I'm not going to say that the vaccine was unsafe. It was probably unsafe or maybe not as efficacious or sort of as useful for young people as it was for older people. I think there's definitely safety signals missed with myocarditis in young men. That's seen all over the world. It wasn't just here. There's the blood clot formation problems in women with the Johnson & Johnson vaccine, which even Paul Offit, who's a vaccine expert, was concerned about when they were talking about the initial development of that one. That was not the mRNA one. That was one with adenovirus. And so that was one he was worried about, that it may cause some problems. But I think we could have had a quick rollout of the vaccine, and there could have been other ways you've done it. You could have had people volunteer, and you could have had more arms with young people, old people, pregnant people, whatever. You could have had follow-up. They haven't had any follow-up. I mean, these companies made billions of dollars, and there's not been any follow-up, like 12 months out, 60 months to see what else, what other effects
I remember
for these
seeing
vaccines.
this like in memes, but like they got the documents sealed for 50 years. I don't know if that actually went through or not, but they were trying at least to get all the records sealed for like a ridiculous, like a lifetime.
Yeah.
Again, you're just like, I get that there's conspiratorial mindsets or whatever, but like people have a right to know what they're actually taking.
Yeah, well, yeah, but that goes to the indemnification, right? Like they probably don't even believe the indemnification will last forever. They want to make sure there's another layer of sealed from liability as a corporation, because you have a couple of those bad outcomes, and you could wipe out your pharmaceutical company, no matter how successful you might be. So, I think that will happen. I do. And that may be something that there's probably support within the Democratic ranks and the Republican ranks. So I think that'd be a bipartisan approval. It'd be my guess.
Interesting.
I also, and Vinay Prasad, I don't know if you follow him, but he's a physician out in San Francisco, has a very good channel, and I'd recommend anyone listen to his stuff. He's very good on this. He's comes from the left, but he makes a good point that it may be a very difficult process for RFK to get through the approval through the Senate, because he's potentially going to upset a lot of really powerful interests in the U.S. government or U.S. economy, which is the pharmaceutical and hospital and device manufacturers. I mean, there's a lot of money that is going to be up trying to prevent him from getting this position. And so by that point, the indemnification, there's going to be a lot of money to try and prevent that from happening as well. And so it's entirely possible that he may not get this through, even though he wants to. But I think there's a reasonable chance that he could maybe through administrative fiat get some of this through. I'm not sure.
Yeah, because they'd have to pass a new law to repeal the old one.
I think so. I mean, I guess, I would think that'd be something that you'd have to pass through Congress. So maybe that wouldn't get through. But things that he could do, I think he'll absolutely change the way they do school lunch programs, the nutritional requirements for the schools. I mean, I think he can snap a finger. He can just change that. He can probably
remember how the right was so mad at Michelle Obama for the same thing. But I'll tell you, my daughter goes to a grade school, and it's an IPS poor school in a poor district. The food is she won't eat an Uncrustable here because they have a different type of Uncrustable, which definitely going to be banned. But the Uncrustable is like the frozen peanut butter and jelly you get from Smucker's. But theirs is like an Uncrustable, and the bread is hard, and it's like powdered peanut butter in the middle. And like she just refuses to eat lunch there because it's all so bad. These kids don't eat the food. She's like, nobody eats the food. It's horrible.
Yeah. Well,
because it's like the most processed, tasteless, awful, like your hospital food is like Ruth's Chris compared to what she's getting at these schools, Dr. Larson.
Well, we always joked about it when I was a kid. It's, government cheese, right? We always talk about the government cheese that you get it, right? And it wouldn't melt or anything. So like Velveeta. So anyway, I think that will change. And, how that actually gets the funding for that, all sort of things. But I think that's going to change as far as, food pyramid, those sorts of things are going to change. I think he's going to go after a lot of these dye and additives to foods. And I'll admit to you, I don't know enough about this to weigh in one way or the other, but I think he's going to do that. I do think he will be able to unschedule marijuana and the psychedelics. I think that will happen as well, where he'll decriminalize that, which I think will be advantageous for a couple of reasons. So that it'll be a lot easier to study it. Right now, you can't get funding for studies it's very hard for getting controlled substances. So it'll be a lot easier to study and to find out if these are efficacious, if these work. Like if marijuana is helpful for chronic pain, if psychedelics help with PTSD, those sorts of things. And there's certainly things that suggest that are helpful, but it'd be nice to have better, robust studies, and it'll be easier to do if it's not illegal.
That was actually the only thing that Hillary Clinton said in 2016 that I liked. I was on the opposite side of her on everything else, but she explained that you can't have these major university systems study marijuana. Or she was talking about marijuana, but psychedelics, I think, has come on in a big way. And so now you've got people just kind of out there with personal experience. And hey, that's the free market, baby. You take it, you accept the consequences, that's fine. But I think if you had researchers kind of trying to understand the process of these things, what they actually do, I think that would be very solid and really interesting because everything runs on federal funding and they can't research anything at this point.
Yeah, no, it's very important, especially when you're trying to get a study, even if you're doing funding outside the government, if it's illegal or illegal to use in half the states or whatever, like it's harder to have a population wide study. And so it makes it a lot easier to get these things through a center study.
When things are illegal, the cartels do the studies. That's the problem. The black market.
And they might really be biased. You'll also, so like I said, the food pyramid, I think you also see the change in regulations over things like drinking water, pesticides, food additives, those things. I can't comment on many of them because there are a number of countries that do those things and some don't. And so, I think it's not unreasonable to have discussions about this. This is the equipoise, right? Like our question is this helpful? Is this dangerous? Whatever. I think you just need to find out and do your best to try and figure those things out, but you have to have an honest discussion about it. And so I think he's definitely more skeptical of all that stuff. I don't know exactly what that means, but you know what I'm saying? I think he's willing to ask questions, maybe more than he should. Certainly speaks from a level of authority that he probably does not have, but I think those are reasonable questions. And I think also the other thing that he will definitely test is, in some way, is vaccines and and how that actually plays out. I'm not sure, but I think, like I said, there was bad studies with the vaccines with COVID, but I think he's going to have some more. But I'll say this, and I know, I don't know the audience. I don't know where the audience falls with vaccines.
All over the place.
Yeah, and that's my guess. And I will only say this, and Vinay Prasad made this point too, which is a very good one. But I think it's very easy for us to just say vaccines are good or vaccines are bad. And this is very much at fault is the medical industry, the public health industry, to say that all vaccines are saving lives. They do all these great things. And yes, some vaccines do save lives and do great things. Others are sort of on the margin and some are maybe not that effective. But I think we have not been very honest in trying to promote vaccinations to not differentiate between the vaccines we're talking about. And I think that's really important. It's like really easy to say,
when we went through my kid's schedule, it's like, okay, I get the polio vaccine, but why do they need a chickenpox vaccine? Right? Like MMR, but a chickenpox vaccine like that, I looked it up because I was so annoyed by it. I was like, why are we doing this? And I went back and there's like 7 deaths a year, or some crazy low number. And they're all very vulnerable children who get chickenpox. And I guess we're herd immunity for those kids, but like if Robert Kennedy, and you tell me, but I don't know. He says that the reason you have the dead virus vaccines have toxins is the more toxic you make the vaccine, the harder the body works because it confuses them and it accepts the dead vaccine instead of just ignoring it because it's got mercury or aluminum in
there's
it.
no mercury in things anymore. Yeah.
You're not an epidemiologist, nor you're an
I'm not a pediatrician.
anesthesiologist.
My wife is a pediatrician, and so she's,
Okay.
she's very pro-vaccine in general, for whatever that means. But
Okay.
there's plenty of vaccines. She talks to me. She's like, yeah, this vaccine's stupid. We shouldn't be doing this. You've got to give 1 million doses to save one life. For instance, I can't remember what it is, like a Pneumovax, or I shouldn't even say what I think it is. But they, like, my son had to get it to go to Purdue University. They required it. And she's like, it's just a dumb vaccine. It's just a waste of money. There are obviously chance of side effects are incredibly, infinitesimally small, but the chance of actually saving a life is almost negligible, Now, chickenpox, at least when it came out, especially when a lot of people are getting chickenpox, like everybody got it, it actually caused quite a few deaths. And so it was more than I realized, because I'm like, oh, well, everybody gets chickenpox. But the problem is, of course, everybody who got chickenpox, they're still around. The people who got chickenpox aren't around. You don't you hear that all the time with people like, well, I got mumps when I was a kid. I was fine. Like, yeah, but the 3 people who got mumps who are now deaf, they're not fine, but you don't talk to them. So there's a selection bias that occurs too. And so I'm not saying that. So anyway, the point is that vaccines, it's real important to recognize that vaccines are all different. There are different types of vaccines, different diseases they're trying to prevent. They're different times and schedules. And so it's just if I were to say drugs are great, drugs always work. All the medications are, believe in medicine. Well, what does that even mean? I mean,
trust the science. Well,
but if I just said believe in medicine, like even medications, you're like, well, sometimes they don't work for me. I know that I've had allergies, or this medicine didn't lower my blood pressure like it was supposed to, or that one did. So just the blanket statement that medicines are great or vaccines are great is not helpful. And then when you have a vaccine like the COVID vaccine that was helpful, but it didn't do what a lot of the proponents claimed it would do. And then if you try to say, well, actually, if there's natural immunity, there are other sort of ways of modulating the disease process, not just with the vaccine, that you're shouted down like you're a crazy person. And that was in the public square. And that anybody who would suggest otherwise was a crank or whatever, like Jay Bhattacharya, right?
Yeah.
Or Monica Gandhi, people who are like, even on the left, who are very pro-vaccine. They were sort of shouted down like they're crazy people. And then people realize that it's not true. Well, now you're going to get the problem that you have. And so the one thing people are very concerned about Robert F. Kennedy ushering in a wave of vaccine hesitancy. And I'm sorry to say that train's left the station.
Yeah.
It's not coming back. RFK, whether he's HHS secretary or not, vaccine skepticism is here for probably generations. And it's a sad state, but it's public health's fault. It's medicine's fault for just having a non-nuanced approach to things. And I don't know. I mean, my wife's seen it. There are more kids with pertussis now. They're newborns. There's going to be problems with breakouts of, I can't think of right now, but they're having these breakouts because they're getting below herd immunity in these diseases that just, didn't happen before. And you can chastise people about this or whatever, but this is the natural result of I'll say misinformation campaign that was set up out by the pharmaceutical companies, by the media, by the government, by professional organizations. And so this is exactly the blowback you expect. And I don't see a solution to it, except that just the way things are going to be right now. And it's sad because these are really life-saving. Some of these vaccines are super important, life-saving, but the way you treat people, you can't treat people that way.
Yeah. And I feel like Trump is so much, it's just the infantilization of society. Like, look, we're the experts, just trust us. I think it's most prevalent through the COVID discussion, but there's so many different areas that speak to why populism is surging. It's not just COVID. It's the economics of it all. And like, oh, well, globalization and immigration are good. I agree with those things, but I can see how if you are a low-wage worker competing with those immigrants because your job was shipped off to China or Mexico, you disagree with me, right? No. Now you'll just learn to code and you'll be fine. And that doesn't work. That's that elitist, arrogant attitude of we know better than you. And yes, it comes from the right too, but there's just a strong sense on the left of like, you need to toe the line, watch yourself. And in medicine, you go to the doctor and, I don't know that you and I have talked about this, but when we had 5 miscarriages up to Matthew, my wife was pregnant 6 times in a year and a half.
Oh.
And we were trying to figure out what was going on. And if you ask questions of most of the doctors, I would say 85% of the doctors that we kept going to different doctors until we found people who would take us seriously. I'll never forget this one doctor at the fertility clinic at IU. Once she found out we were not going to do IVF, she was not, we don't need to test you for anything. Like, I'm sitting here, 260, like, maybe tell me to lose weight at least and test something. But no, we don't need to. We just don't know why you're just going to have to live with this condition, which was a crazy thing to say. And if you would ever go back at a doctor and ask a question in that period from 21 to 23, not you, but there was this strong sense of like, why are you questioning me? Yeah. And I mean, it's like the price of eggs. Donald Trump didn't need to buy mailers. The perfect mailer was in the grocery store. Every time you went to the grocery store, it was right. It was a mailer, a TV commercial against Joe Biden and Kamala Harris. And so every time people go and pay a lot for drugs at a pharmacy that's overworked, pay too much for a $500 bill for an ER visit to go and sit in an ER for 4 hours because my son fell off the couch.
That's cheap, $500. Wow.
Yeah. Bad bedside manner. I just... Yeah.
Right.
It rubs people the wrong way. And then you come in the major health crisis, and there were some people who were trying to get the word out, but it's polished. Like, this is why the left doesn't have a Joe Rogan, because there's this like polish that experts and people who are in a field come with because they're trying to climb a corporate ladder, that it just doesn't resonate with people. It feels like you're trying to propagandize me. And so I get why people have skepticism about, like, the food stuff. Like, we all know that salt, sugar, and fat are really tasty, and that's why they put salt, sugar, and fat in everything now, and MSG and things. And we know there's something wrong after 20 years of, documentaries that the food supply, there's something not going on that's right. And so the food pyramid just seems like bunk, but they keep pushing it, right? So I think it's just natural for people to have this reaction. And the best way to handle it is not to censor people, not to shut them down, not to, like, you can take Alex Jones' entire business, but Alex Jones is just going to pop up on X and have 3.5 million viewers like he did the other night.
Right. Exactly.
You have to engage and have discussions and go out and, as a doctor, come out and do what you've done with Paradocs, or have people come out and have debates and have a public conversation, and not be scared of people who question whether or not a diet of what did my mom used to eat? And it never worked because she was eating low fat, dairy, and nothing but grains.
Yeah, right. High carb, low fat, whatever.
Right. And you're just like, you're miserable, you're bloated. So
yeah, well,
I totally agree.
That's Jay Bhattacharya's point, right? His point is we need to have discussions about these things. We need to have open debates, not closed discussion, email discussions where we're talking about what's happening, but have a forum where you have people who are on opposite sides discussing what's the best diet, the pros and cons. You may find out you can't really come to consensus. That's usually the case, right? There's lots of times we don't really know what's best. It's the paleo diet. It's the Atkins diet. It's, who knows? It's just doing things in moderation, intermittent fasting. There are a million ways you can go about a lot of things, but I think that when you try and come to sanctimoniously tell people what they're supposed to do, especially as we have, I think it's a computer age thing, where as things become more and more accessible, like behind the curtain, whether that's what media is really like. Who are these journalists? What, they're going to all these parties? I didn't know they were going to all these parties, hanging out with these politicians, and they're married to the chief of staff of the Speaker of the House or something. Well, of course they're going to give that story that's, deferential to someone.
Scott Gottlieb was a great example of a guy who was Bush's FDA director. And then, he works at AAI, a conservative think tank as well, yep. But he's also on the board of directors for Pfizer. So when the pandemic hit, Scott Gottlieb was on every single program explaining what was happening with the pandemic for a year. because he's at a think tank, he's a conservative, but he's on the board of Pfizer, and that never ever was mentioned. Like when, disclosed, right. It reeks of corruption.
Yeah, but I think the fact that we know these things a lot more, we recognize that there's a level of, there's not the expertise is not at the level that people project, or it's projected. So, I mean, I hope I'm not coming off as someone who's an expert in everything in medicine or even much. It just is very small bit of my field. But I think it's important to recognize that people just realize now that not everyone's an expert. It does. And it was hard during COVID, partly because it was hard to communicate. I never realized how hard it was for some older people to know what I was saying when I had a mask on all the time, because I wasn't allowed to take it off. And so that was a problem. Also, just the fact that it was just when you isolate people socially, they're just not normal. And we all experience that, right? As we're isolated on some level, or, people are treated as disease vectors everywhere you walk. It is not healthy mentally or socially or culturally. And so I think that caused a lot of animosity and just a lot of more conflict just in everyday settings that you shouldn't have had. And certainly in the office and stuff. But I would say in general, physicians are very much partly don't have time to have a discussion to get down into whatever it is, whatever the condition is. And so you're not going to do if I'm a surgeon and you're not interested in surgery, I'm not going to really spend much time talking to you. If I'm fertilization, I'm not saying it's right, but I think that's just the reality of what happens. And so, I don't know, that's just.
And the big hospital systems, which we'll touch on in a minute. Jim says, debates are how people learn and become informed, and we are a nation of sovereign citizens who deserve no demand that our public servants respect us and our right to know what is happening. Yeah. Ron says, tobacco companies bought the food companies in the 80s, and the food is ultra processed now. And I do think that's he jogged my memory, because I heard not RFK, but an advocate for RFK today on Fox News talking about what his priorities should be, and his advice to his friend. I don't remember his name, but he was saying we need to treat the food companies like the tobacco companies and litigate, get them in court, force them to start removing sugar, removing high fructose corn syrup, and the subsidies that led to high fructose corn syrup. Like, what is your reaction to that? Like, should the Trump administration and look, it's a problem that we've got these things in there and we need to go after them and use the force of government. How do you feel about that?
Well, I mean, I'm all for getting rid of subsidies and letting the market decide if people want to have sugar in their Coke, or if they want to have high fructose corn syrup. I generally think, and again, this goes along the lines, I don't know that we know everything, right? I think it's easy to say, we know this is a bad thing, that we know this is a good thing, but it may be different for certain populations. Maybe it's better for men or women or kids or adults. I mean, I don't know the answer to these things. What's best is to leave it, sort of open as a market, not try and put your thumb on the scale one way or the other. Now, obviously you don't want people to eat consuming things that are like truly poison, like arsenic and everything or something like that. But things that I think where there's not a certainty, I think you have discussions. You say, what do you think's best? I probably don't know. And we can't speak with certainty with things we don't know. And so it's probably not right for government to say you should do one thing or the other. That's just my opinion. And if you can get rid of subsidies, obviously that eliminates a lot of the thumbs on, on the scales. And so then we can kind of just figure out where the market goes. If people decide they want sugar, cane sugar, or whatever, or seed oils or not seed oils, I don't know, whatever you want to do. You just kind of
Heinz, man.
vote with your dollar, right? That's the libertarian way.
7 or 8 years ago, I heard tale of Canadian ketchup, and I was like, "Oh, I want to try this because it's all natural ingredients and no high fructose corn syrup. Just
is it
basic
sweet
tomato, right?" And so I specially ordered Canadian ketchup, and then Simply Heinz noticed that so many people were doing this that they came out with Simply Heinz, which is now on your shelf at your store. You have two options. You have the Simply Heinz, or you have the regular Heinz ketchup, which has some of the other extra ingredients. And there is a taste difference. I do think there's a taste difference. But real quick before we go on to the next chunk, but is there a place, for people like me who have young kids trying to figure out all these vaccine debates? Like, do you or your wife have like, okay, we've heard these arguments because they're easily to access on Joe Rogan, right? Are there like pro-vax websites that like are really solid that you would recommend to people?
Yeah, I mean, I think one of the definitive books is Paul Offit. He is, and so he's developed vaccines. He developed a vaccine for, I think it was RSV. Rotavirus. I think it was rotavirus. But he's a very sensible person. He works at Children's Hospital, I think in Philadelphia. I think it's Philadelphia. I think he's at CHOP. And I think he's a pretty good advocate for, and he's someone who is willing to talk, and he's willing to look at real evidence. So for instance, he didn't get a booster for the mRNA COVID vaccine because he's like, there's no point. Once you have the baseline immunity, it's not going to prevent disease except for maybe a month or two or something like that, prevent infection. So all you can do is do disease modulation, which means that your body mounts some sort of immune response. It's not going to keep you from getting the infection, but you don't get as sick. And, a lot of our vaccines will work that way. Flu vaccine is a good example. Flu vaccine will not usually prevent you from getting the flu, but it'll prevent you from getting really sick from the flu. So instead of being out for 2 weeks, you're out for 3 days or something like that. And so, and he did not recommend it for his son, who was in his, I think, 20s. He's like, I don't think you should get the vaccine at all because you're not at an age at risk for getting bad outcomes from COVID, and you're only at risk for getting the side effects, the myocarditis, for instance. And so he said he didn't recommend any of his grandkids get the vaccine. He didn't think there's any point to it, that it was just introducing risk with hardly any reward. And he didn't have any super high risk grandkids, but there are very few kids who are ones that you'd be that concerned about. But also just, he recognized that vaccines are not magic. They just create an immune response and memory within your body. And once you have that memory, usually it's persistent, not always. Sometimes you have to get a booster 20 years later, something like that. But once you have that, there's not much more you can do. You can't have antibodies for every virus that exists in the world in your body circulating at any one time. We know this because we continually get sick throughout our life. We always get colds, right? A couple of years, something like that, as long as you have contact with enough people. And that's because if you had antibodies all circulating for all those viruses all the time, your blood would be like ketchup. It'd be like that high. It'd be so thick, It wouldn't work. And so it has, you can't, your body has mechanisms to say, okay, we're going to allow ourselves to get sick. We can have a quick immune response. So we get sick for a day or two or three or whatever, and then we get over it. And that's how your body's supposed to work. It's not supposed to have continuous, antibodies marching around for that very reason, because you couldn't survive. And so it's a complicated system, but it's the one that we have. But he at least recognizes that, and he acknowledges it. And so I think his is a good book. I think it'll make you more comfortable with a lot of vaccinations. And I don't think he's going to tell you to take stuff that's not worthwhile. Now you can make at some point, figure out which ones are things you're worried about, not worried about. But I think that's your decision to make.
Yeah, I mean, I'm like on the board of a homeschooling organization, so like I'm just surrounded with the anti-vax stuff. So it's like, I want to know the pro-vax side too.
Yeah,
so
well, I mean,
that.
it's again, vaccine is not a good term in the sense that you shouldn't be anti or pro-vax.
Right.
It's sort of like I agree that these vaccines are helpful or these are not helpful, and that's, I think, a much
anti-vax
much
really
healthier.
kind of is like a slur, isn't it? It's sort of meant as a pejorative.
Yeah, and I think pro-vax is the same way. Like you see people throw anti-vax people will throw that around. It's like, oh, this guy's in favor of the 85 vaccines that kids have to get 72, whatever the crazy number that people throw around by the time they're 18. But 18 of those are flu vaccines you get annually, so I guess you don't have to do that. Now you're down to 54, and then you get anyway. So a lot of those are sort of overblown. Anyway, we don't want to get into the vaccine debate anymore. I don't think it's very helpful with talking about RFK, but I just think it's pretend to be nuanced and be sensible in how you discuss it. I think is my recommendation.
Yeah, sorry if we got stuck on it. I just think it's
no. I think it's a good one.
Associate with him the most for sure. I think that's why he's unpopular. Like Rogan opened his podcast. Yes, Rogan opened his podcast, and I think this is why so many people have drifted towards the right. Back to what you just said a little bit ago, like there's almost a signaling of stay away from this person. Don't listen to this person. Don't, because if you're exposed to the knowledge, then all of a sudden you're going to morph into a bad person too.
Right.
And so I just, I think that's, we can look at what he wants to do honestly here. Now we have to give him some suggestions because we know he listens.
Right.
What are some things that, from a libertarian perspective, I guess, or just from a guy who works in medicine every single day, what do you think Robert Kennedy Jr. should do now that he has the power to come in and make medicine more affordable, more effective, and make America healthy again?
So there are a lot of things that he could do that he actually has the power to control a lot of it, I think. And it's to change the regulatory process within various aspects of medicine. I think one thing I think we probably all agree as libertarians, probably most people on the right would agree that you want an innovative, more of a market system within healthcare. There isn't one right now. And if you bring disruptive innovations into the healthcare space, whether it's the way you administer medications, whether you put together your health system, you're in many ways prevented from doing that. And so loosening those laws or removing those restrictions would be very helpful. And there's some more specific ones you could do. I think, with when it comes to your spending with HSAs or flex spending, you could actually spend out whatever you want as far as you have less restrictions, I guess, in what you think is healthy, whether you think you should go to a chiropractor, whether you should go to a direct primary care physician. Those things should be available to you as someone who's buying healthcare services. I think that would help. That would open up the ability to get better voices within the system. That also, hopefully, and this is why it will be less likely to be successful, it would hopefully break apart the monopolies that exist within the healthcare system right now. I mean, most people, wherever they live, they have one or two health systems that pretty much deliver all the care, pretty much own most of the physicians and the care within their town. There's some independent centers, depends where you are. And so it really limits your options and then makes some things more expensive and just, you've got to travel
I go to an independent doctor. I go to an independent doctor and she is constantly under siege from other doctors in town because, she doesn't work with the Ascension group and she doesn't work with the university group. I mean, University Health, IU Health here is like 33,000 employees. St. Vincent Ascension is 7,000. And that's the majority of the state kind of falls under one of those two jurisdictions. And if you're not part of it, it's a huge problem. And I think this is also a little bit of what comes in with some of the Dobbs ruling and the complications around ectopic pregnancies and abortions and miscarriages. Like, not only do you have lawmakers making laws that are usually bad laws, but then you have healthcare organizations that set out those roadmaps and don't want to take on legal liabilities. And like in our case, it was just like, what are you? That doesn't
you can't
make
escape
sense,
it, right?
Right.
I mean, when you're left with just Coke or Pepsi,
systems.
you're just left with Coke or Pepsi.
Yeah.
Right. You don't have 7-Up, Dr. Pepper, A&W, Faygo, whatever. Faygo. That's showing my Michigan roots here.
That's what the poor kids drink for everybody that's not from the Midwest.
And Verner's, right?
Yeah.
So you want more options and choices, and we expect that in most parts of our life. There's no reason we shouldn't expect in medicine. There are plenty of people who are smart enough who can deliver care, and so the more options we have to allow them to deliver care, the better off we're going to be, and probably the healthier you're going to be too. The more likely you're to find someone who matches you and how you like to do your work on your health.
Yeah. So touch on direct primary care physicians too.
Sure.
Because that I think plays a huge help in all this.
Yeah. I mean, I have a direct primary care physician. I've talked about a lot on my show. It's not really a complicated concept. Basically, a direct primary care physician is just someone you pay a monthly fee to be your doctor. And so it's like we all gym memberships or whatever. And it's basically just buy a membership, $100 a month or something like that. And you have someone who's usually accessible 24/7. They can do your primary care. They can suture you up. You can get some maybe labs through them. You can, they're going to know you better because they have a membership flat fee. Usually they have a much smaller patient panel, and a panel just means how many patients you are taking care of. So if you're in a typical family practice physician, let's say within Ascension Health or University Health, you probably have 2,000 to 3,000 patients in your panel that you're responsible for. I don't have to tell you, it's pretty hard to keep track of 2,000 or 3,000 people and, to know them. I mean, if they've been in your practice a long time, maybe, but there's even more churn within healthcare. But even that, if you now are 500, it's a lot easier to keep track of 500 people, because likely you're not seeing all 500 every year. You're probably seeing, 150 or 200 frequently, because they're the ones with the chronic illnesses that are coming in more frequently. So it's a lot easier for them to be familiar with you and your condition. They usually see like 7-8 patients a day. So they're no longer seeing you in 15 minutes where you get really 3 minutes with them and, 13 minutes with the nursing tech or whatever like that. So you're spending a better relationship and probably better care overall with direct primary care. And even areas that, like I know Lee Gross in Florida, he does a lot of charity care, and they did much better job taking care of the poor, because you can dedicate part of your practice, say 10% or whatever it might be, to doing free care to people, because you got time now. And so you're going to provide much better care than they're going to get at the hospital with, Medicaid services. So anyway, direct primary care is a great way to do things.
Yeah. Thanks to you talking about it. I went out and looked for one. Like, I had seen my doctor since I was 16 years old. He probably doesn't know I'm not even a patient anymore. I just realized, like, okay, I've been coming in here 330 pounds and you didn't do a blood test on me, or, that was 15 years ago. There was never like, let's run a blood test, let's get a heart scan, let's do these things. Like, here's the schedule you need to follow. It was just sort of, how do you feel? Okay, well, walk and exercise and eat better. All right, see you next time. Right. It was, it was, when I got an infection in the back of my neck in 21 or 22, my heart rate was just off the charts. So he finally measured my blood pressure, and he's like, "Oh, we need to put you on medicine. You're like," I was like 170 over 120. He was like, "You're going to die." And then I found somebody who, it's a DCP, but they take my insurance. So they're not like a
DPC, just to be clear.
DPC. Thank you. I get that confused, but man, she is on my butt to get a blood test every quarter. You need to go get a heart scan so we can set a baseline. Here's your exercise routine. Are you following that? Are you doing that? Like, she genuinely cares about her patients. And I found out I have a pituitary tumor. So she ran all these blood tests, and because my prolactin was elevated, she realized that she had me do a CAT scan and found out I have a pituitary tumor. So you just take a medicine a couple times a month, and then it regulates that. And it's not, I'm not going to grow gigantic or anything yet, but my old doctor never would have found that, Dr. Larson. It's that level of care that thinks about the patient that actually, all medicine should be I wish everybody could go see this doctor, because my friend is pregnant at 41 with a child that she's been hoping to have for 8 years, because she went in and they did a level of care that you wouldn't get at a big system. It's really great.
Yeah. I mean, I think the important thing to point out too is that it's not like that other doctors aren't caring or that they don't, but it's the system is not designed in order to allow them to investigate, to know their patients, because they're entirely pushed on productivity reasons. I mean, my direct primary care, my first one, who had just retired, she switched because she's like, they kept coming to her and saying, "You're not referring enough patients to our other services." And she's like, "Well, the reason I'm not is because I know how to treat this stuff. That's why I'm in primary care. I can treat these things. I don't need to send them to specialists all the time." And well, you're not doing enough. And so so there are all kinds of outside pressures that are changing the way you practice. And so that's why physicians like it more. And it allows, just because you don't have as many patients, you can know them better. You can hound them more, like you and people who need the extra encouragement. So it just allows that extra bit of oomph you need to have a successful relationship. So, I mean, that's why I don't really ever see the doctor, hardly ever, once a year. But when I do need medication or something like that, it's really easy to do. So it makes it easier for our family. And so when we need it,
what else should he do?
Yeah. So that kind of just actually leads into the fact that having physicians have a little more autonomy over the system. I mean, there's no better person to know how to run a system than someone who's actually in the system itself. Right. So it's crazy. There are most laws preventing physicians from owning hospitals and surgery centers, for instance, both state and federal laws. And so they need to remove that restriction. I mean, that doesn't make any sense to me.
I would think that the rule would be, if doctors and physicians and surgery folks owned the centers, then they might, see profit centers and people, and therefore come back next week, or you need the surgery that's not necessarily needed. Is that the thinking? That's just my uneducated guess here.
I imagine it is, but I can tell you the people who are administrators are less likely to be restricted by any sort of like ethics or concern about the health of a patient, because they're more concerned about the numbers. They don't even care if they're, you're doing more unnecessary surgeries, just so long as you're doing more surgeries. So I think that is always a risk, no matter how you have the system set up. But having physicians run it, at least they would have sensible ways of running things, as far as they'd be less likely to adopt silly bureaucratic processes, which we get all the time. And those are hard to point out exactly, except I can tell you there are plenty of them. And so having a physician, it'd be a little helpful. It certainly removes some of the monopoly of these administrators within the system, which also brings you to medical boards. There's only one kind of like medical board mainly in the country. And so having one governing body, they set the rules, and we've seen this during COVID. Was like they're bought. The ABIM, the American Board of Internal Medicine, threatened to kind of remove your license, your certification, your board certification, if you advocated the wrong policies, like if you questioned the COVID vaccine, for instance. Or
can I ask what a medical board is? What do they do?
Yeah, so basically, when I graduate from medical school, I go to a residency where I specialize in something. So I did anesthesia, and then once you finish your training, which there's a certain period of time, a certain amount of surgeries you need to do, or you need to do rotations and this, that, or the other thing. You then have a certification process where there's an American board of whatever. My wife's American Board of Pediatrics. I'm American Board of Anesthesiology, and they have certain criteria. You do oral review and you take a test. So that was ours. And it used to be that once you get that, then you're certified for life. Now they've changed the restrictions. So now it's like, well, it's only good for 10 years. And now it's only good for a year, and you have to keep redoing it, and you have to spend thousands of dollars redoing these things, even though you've been certified. But the fact that they don't have any sort of alternatives, or there's no way to, they basically have far too much power and control over physicians and how they practice and what they can or cannot say. And so having competing boards would be helpful, frankly, I think. And there is one now that NBPS, but this is getting into the weeds a little bit. I think, one thing that would probably affect a lot of people is the FDA drug approval process. We all know that it's very expensive to get drugs through. And part of that is because there are two aspects to the FDA. One is the safety. They check to see that drugs are safe. So they have the phase 1 and 2 trials, make sure it's safe in animals and make sure it's safe in small human trials, make sure there's, nothing happens. And then in the later trials, they're supposed to have a monitoring system, which is not very good. It's actually really poor in this country. And so that could be improved. And so RFK could do that pretty easily. And maybe that'd be something that he would do, that they have a better monitoring system. Because the myocarditis that showed up in Israel for young men, they picked up on that right away. And yet, we gave way more doses, and it just was not seen here because our system is very poor reporting system.
Yeah. And as I understand it, like anybody can report anything without any kind of verification. It kind of goes into the database. And
yes.
Yeah.
Yeah. So there were 40,000 cases of this. And that's actually because a bunch of people who don't know what they're talking about put it in there, versus having people who are getting complications that are showing up at hospitals be much more useful, system.
Oh, let me tell you, I call my mom, who's a registered nurse, every other week. I'm like, this is the end. It's over. She's like, just go get an antibiotic. You're going to live.
And then the other half of the team, the part of the FDA is whether the drug is efficacious, means whether it works or not. And that's actually where almost all the money is spent in the FDA, in the approval process. It would probably, I think most people, when they think the FDA, they think, well, the FDA is finding whether a drug is safe to use. And that's what most people think with the FDA, right? I don't think they think about whether the FDA is checking to see that a drug works or not. And that is, compared to placebo or compared to the current treatment medications or whatever. And so it'd probably be much more useful to have the FDA focus on safety, and then whether drugs work or not, they don't even do that, I think. And then that is controlled through just basically through professional societies and other, you could have, basically that's what the studies are for. But I think to have the FDA be in charge of determining whether something works or not it's not a very good process. They're not any good at it. For one thing, they haven't been. Most of the time they say drugs work, they don't work. Most drugs don't work in general. I mean, that's just the nature of, you put you develop 100 drugs and maybe one of them is actually useful. You may think it's useful. About 10 to 15 you think are going to be gangbusters, and then most
Are you
of them
saying the
turn
ones
out
that
to
get
not be
through,
good.
the ones that I'm taking currently, they don't work? Is that the?
It's entirely possible. But
I
probably the ones you're
actually
getting
at
are the ones you
SSRI
have.
of my, one of my drugs. I'm like, oh, please don't recall it. It works for me. At least I think it does, even though they said it's probably just a placebo.
No,
like, okay.
But I think, when it comes to the efficaciousness of drugs, the FDA is a terrible job. And also it invites so much corruption. There's so many problems with, and this is a lot of the, shoveling people into then the boards working for these companies later. They prove the drugs. This is where, Fauci apparently made a lot of money, that they get a lot of funding that comes from pharmaceutical companies. And then you go get your private sector job, or you get paid $50,000 to talk to Pfizer or whatever. So I think that process is not very good. And that probably something the FDA shouldn't even do. I mean, there's probably other ways you could do it that'd be at least as effective. And it would massively increase the speed with which drugs can come to market. And then also decrease the cost, we're all in favor of both of those things, right? If it's truly life-saving, get it out there right away. And, if you want to be entered in that study right away, you can do that. And you can, the right to try. And I think most people generally support that concept. So, and then more obscure thing is like their regional organ monopoly boards. There's a really good podcast from Reason on why we can't have good things, why we can't have nice things. I think that's
why we can't have
2.
nice things.
Yeah, which was on the monopolies of the organ transplant board. Some of the boards are really good, but they're all regionally run. So your region might be good or bad, and may lose organs or have them just get spoiled and not. It's kind of crazy that it works that way. And there should be a process. We have far more entrance into that market, so that you find the best people, the most innovative companies do the best job with the organ donations. So that's a lot of stuff like for just the healthcare system. And then the other things are more like, I think marijuana, psychedelics is probably good that you unschedule that and allow people to study those things. I think it'd be helpful. I mentioned the better monitoring system for adverse events, both for vaccines and for other medications. I think we need a better system for that. Food regulations. I don't know. But how do you feel about raw milk? I don't really care if you drink raw milk.
I mean, you're going to be a lot more informed about where that milk comes from if there's a risk to it.
Yeah. So I tend to think, go ahead, right? It doesn't bother me at all. And
the
so
people
I think
who go and buy raw milk, the criminals out there who do this, know so much about this stuff. And this is where I think like some of my cognitive dissonance in some of this conversation is like, man, the people who research this stuff know a lot of stuff, and then the people that know the opposite information just kind of go, just trust me. And so it's confusing. Like raw milk is one of those things where I'm like, I don't know, should I just like drink only raw milk? It's apparently a cure-all, but yeah, you're an informed person who can make your own decisions. And if you get diphtheria or whatever, or milk sickness, I don't know, then salmonella. And
Cola, I don't know.
Yeah, and in terms of labeling, it's like the Costco recall, just having to bring all this butter back because they didn't put on the label that it doesn't contain milk. It's just silly things like that.
Yes.
You go, come on.
Yeah, I mean, it's just how wasteful it is. And I mean, I hate wasting anything. I can't imagine wasting 80,000 pounds of food that could feed people. Like we have people who have trouble getting food.
People desperately need their butter to be cheaper.
Or everything. I think there are probably some rude food regulations that can be loosened. I think, Thomas Massey talks about this all the time. There's certainly raw milk's one, and sort of the restrictions they have on selling cows. If you want to have locally farm livestock, it's really hard, or eggs and stuff. So I think those things are probably helpful and that it could be done pretty easily. So PBMs too, and I don't know how deep the discussion we want to get to, but pharmacy benefit managers. And so these are the most powerful healthcare lobbyists in the country. They're not insurance companies. They're not hospital systems. They're not the American Medical Association. The pharmacy benefit managers, they're basically the people who create formularies of medications, and they get all their revenue basically through kickbacks, essentially is what happens. and so, essentially what happens is they talk to pharmaceutical companies. They say, hey, we want to put your medication on our formulary. There are three PBMs that exist in the country that supply about 90% or so of the medications to hospitals and pharmacies. And if you don't get on that formula, your drug won't get to market. It won't really make any money. And so you have to be on those formularies. And they'll say, you can come on our formula, but you have to you've got to give us a discount, right? So that's the whole point. It's like we can buy large volumes of medications and provide it to our customers at a discount. So that makes sense, right? So I'm a small hospital, which there aren't many of those anymore, but that's when it originally was created. I'm a small hospital. I pool together with 20 other hospitals. We create a large group purchasing organization that buys all this medicine at a volume discount, and then we get it for cheaper. Except what happens is these PBMs basically, they get the discount, 20%, they pocket the 20%, and then they sell it to you for 100%. And so it causes a couple problems. But the other thing is now they create a strange disincentive that if you are a manufacturer of medications, maybe generics, I think is a good example because you're not making huge margins on generics. But if you need to sell 20 different generics in order to make any money because you have to provide such a huge discount to get in these PBMs, you've now limited the amount of people who can enter the market to sell generics, which, okay, whatever, except it is a big deal because right now, if you talk to any of your friends in medicine, we can't find IV fluid. Why is that? Because 60% of IV fluids came from Western North Carolina.
Yeah.
And they got wiped out by the hurricane. And so if you have and before that, we had the same problem, 3 years earlier, because it was all in Puerto Rico. And so they actually moved the plants out of Puerto Rico, which is more hurricane prone, to North Carolina, which is not, but of course got hit by a hurricane. But the fact that you have a very brittle pharmaceutical industry, because you have to have such massive manufacturing. You can't have someone who just makes IV fluids because you just can't make any money on it. You have to have like 10, 15 drugs. So it has a lot less entrants can come into the market. So busting up those PBMs, busting up that, which is not hard to do, except that they're the most powerful lobbyists in the
other than that little bit. Yeah.
Other than that little bit. But that's something that could help tremendously because I can't tell you as a physician, I've talked to anyone in healthcare, they're driven crazy by the shortage of medicines. I've been short propofol, which is what I used to put people to sleep and sedate them. I've been short local anesthetics. That was like last year, the year before. IV fluids twice. I've been short fentanyl, ironically. We're short fentanyl for a while. Morphine, Dilaudid. I mean, just about any drug you can think of. And these are just ones that affect me. There are plenty that like chemotherapeutic agents or other medications that you need, heart medications that are important. Because we just have a system that is really not robust, and it's because of these PBMs that force it so that not as many people can enter the market. So anyway,
yeah, I don't know that. I mean, I'm not blaming them for the fentanyl crisis, but I think movies like Dope Sick on Hulu, for instance, where you see how entangled all of this is and how just like, obviously it's the worst story. Like I've had lots of family work at Eli Lilly here in Indianapolis. Great company. They care about people. They're not monsters trying to rob you for it's not the Sackler family. Is Sackler right? I think
maybe,
so, but
I'm not sure. I'm not.
But I think something like this would be very popular because that has been primed by trying to wrestle with the fentanyl crisis of the last few years and learning about it and reading and watching Dope Sick and books like that make you go, man, this whole industry seems really corrupt and something needs to be done about it. And that's a great, I had never heard of that. That's really interesting.
Yeah. And it affects all of us. And the problem is look how long it took me to explain it to you. And that was, I barely scratched the surface. And it's, you talk to someone for 3 minutes, they're going to be, the eyes glaze over and they don't care.
Explain that to Trump. Write that in a tweet. What?
The last thing I would suggest that would be great is if with CMS. So right now, the way they pay Medicare is they pay based on where you get your care. So if you get it through a hospital system, a heart cath, they pay X amount of dollars. If you get it through a private individual and independent, it's 1/3 X. And so that's generally how their payment system works. So there's a massive disadvantage to not be within a healthcare system to get any sort of care, which of course prevents, creates consolidation. within the healthcare space. And so there's less options for you. So you have Ascension and University of Indiana, right? You only have 2 options. In our town, it's 3 options, but most places it's not that many. And it's because of this. I mean, this is one of many reasons, but this is a large one, that there's such a huge disadvantage to trying to be independent outside the system and to make money. If you're going to make 3 times more money, you might as well just go work for the man, and takes away some the problems from from an overhead perspective. But it comes to the cost, and it comes to the cost that suddenly you have production pressures, and you've got to treat. Now you have to see 6 patients an hour. Oh, now you got to see 8 patients an hour, whatever it might be. And so, you can't. It eliminates a lot of the individuality, which I recognize there are some advantage in having a algorithmic sort of approach to certain parts of medicine, but in other parts, it certainly stifles innovation and disruption, which can be sometimes very helpful, and find the truth, or find at least different options for certain people who need different levels of care.
All right. I mean, those are all great suggestions, and I feel like they're all very doable suggestions. You picked out things that like an executive could do, right? That you're not.
I tried to.
Like, yeah, you're not like fix the ACA and pass a law.
Right. Yeah.
Right. Forget it.
Repeal Obamacare. Right. Yeah.
Right. Nothing grand and big, but those just unlocking innovation and allowing for better research from the people who do it. These things seem very common sense to me. You're a dreamer.
I'm a dreamer. Yeah. Well, I think, it's funny because I talk about this in my show all the time, but it was when it comes to fixing healthcare, we all agree it's broken. It doesn't work real well. There are solutions, and the key is creating a market, or at least allowing the market to work. And you found that DPC, you found a way that you're getting better care. You're not paying through the nose. I mean, you're paying a little bit of premium, but not like you're not broke because you're doing it. No. It's very reasonable. Where you go broke is where you go to the ER, or where you have to use your premium and you get a deductible. And I mean, I've gone into all that sort of plenty of times too on my show, but I think the way you fix these problems in medicine is not going to be repealing the law or passing a law. It's going to be just allowing the market to kind of do what it's going to do. And people are just going to vote with their feet, with their wallet. I mean, I think that's essentially what's going to happen. That's the only way that we're going to get real change. If you don't, then all you're going to end up with is a nationalized system at some point. It's already, 60% nationalized. If you look at the Medicare and Medicaid system, I mean, how much care is through them, or at least the rules dictated by them. So anything you can do to try and allow other entrants is going to be helpful.
And then you have like 4 insurance companies doing private insurance, and it's the block grants to the states for their Medicaid.
And then they buy the PBMs. And then they buy the PMs because they realize and so now we have, or you probably have, I imagine, I'm just guessing, there's University of Indiana Health. Probably there's like a University of Indiana health insurance, right?
Yeah.
And so you have a health insurance company that is also a hospital system, and they probably have, so you're like, how is that possible? How can we have an insurance company and a healthcare system? They should be at odds, but yet they can work together in tandem because they just drive up prices. And, that's how their model works. But anyway, it'd be nice not having to try and prevent consolidation. I think one of the basic libertarian tenets, outside of, not aggression or whatever you might say, is local subsidiarity, to try and on the most local level to make decisions and to have affect change. And so the smaller you can divide things out, it's usually the better, I think, than having just like I'd rather have the state government or the local government have some control over me than the federal government, because I can't change the federal government very much, but I can at least move across the county line, if nothing else, to get away from a bad law that's local.
And I think a lot of people are realizing that, maybe taking all this federal funding is a bad idea because we might get a president that doesn't share our values. Every university right now is shaking. Like, all right, quick, cancel the certain classes. So before Trump finds out, and that federal money just makes everybody so dependent on the federal government, and that comes with all kinds of strings attached. Like, I served on a state commission for voting, and you needed the money, and you had 13 priorities, but the money was going to pay for 2, but then it came with all these unfunded mandates. You had to do the 13, but you could only do the 2 realistically with the money that they were giving you. So it's just, let's hope Vivek and Elon succeed with Doge, because there's a lot just in this episode, in this one little vertical, right? That there is so much waste and fraud and silliness that could be rolled back if somebody actually really is serious about taking a look at a lot of this stuff. Yeah, all right, well, Dr. Larson, where can people find out more information about you?
Well, you can follow me on Twitter. I'm not too active there, but Eric L. Larson. You can also certainly go to my website, The Paradox. That's theparadoxshow.com. Or just look for any podcast player, or go to the We Are Libertarians Network and find The Paradox there. You can download. That's probably the best way to do it. If you're interested in Michigan State basketball, the Final Four is on the schedule.com or tffinots.com if you're lazy. So you can find our podcast, of course, any podcast player as well. So I don't know. That's probably the best place to find me. And hopefully, I'll be on again. Maybe if we just start doing some real stuff, if Arcade gets through and we then something happens, we'll see. I love. This has been super insightful and helpful, and I appreciate the time. Oh, my pleasure.
All right. Well, thanks for joining us here on the Chris Spangle Show. We are so glad that you joined us. If you got something out of this, if you learned something, please share it with your network. Hit that share button if you're watching it live, or go to Facebook and say, hey, I learned something here. This was really interesting. Check it out. All right. Thanks for joining us here on the Chris Spangle Show.